Frequently, couples have questions about the difference between a fresh embryo transfer and a frozen embryo transfer. Studies have shown since about 2013 that, ironically, patients who undergo frozen embryo transfer have a higher live birth rate and a decreased risk for pregnancy complications and problems with the baby. Fresh transfer is quite safe. However, because we're always striving to have the highest live birth rate possible and the best outcome for the mother and the baby, we perform more than 90% frozen embryo transfers at GAGO IVF. When we do pre-implantation genetic testing, the embryo is biopsied 5 to 6 days after the egg retrieval, but then it is frozen, and we wait for the genetic test results. We allow the uterine lining to cycle, the woman has her menstrual cycle, and then we move on to either ERA, or endometrial receptivity array testing, followed by frozen embryo transfer, or move to frozen embryo transfer, which involves about a 2 to 3 week process of preparing the uterus for the embryo transfer. Typically, we, ahead of time, make the decision to transfer a single euploid or chromosomally normal embryo. The embryo is warmed the day of the embryo transfer. We ensure that it has had good survival. A photograph will be taken of your embryo so that you can see what it looks like, and then you will be brought into the embryo transfer room. You will take a Valium that day and have a full bladder. The catheter will be gently passed through the cervix, and then the embryologist will bring the embryo in an inner catheter, which will be threaded through, and the embryo will be placed under ultrasound guidance into your uterus.